Welcome back to the Pediatric Airway Breathing Project. I'm your host, Dr. Pia Gandhi, and today we have on a good friend and colleague, Dr. Caroline Long, who is a chiropractor and owner of Westview Wellness. She has been doing chiropractic care for
25 years.
25 years. One of the most seasoned practitioner I know, and has been doing work with pediatrics, infants for a long time as well. So I'm really excited to have this conversation today. I personally knew nothing about chiropractic care and had never been to a chiropractor until I got into the airway and tongue-tie world.
Yeah.
So I'm excited for her to share all of her knowledge with all of you today. So thank you for being here.
Thank you. I remember our first lunch together.
Yeah.
Yeah.
So tell us about yourself, about your 25 years in practice, and I know you've also had a business journey along with that, and specifically would love to hear about your background in pediatrics and infant care.
Yeah, thank you. So I wanted to be a pediatrician growing up, and I thought there was nothing better than working with kids. But then, as I went through college and everything, I realized being on call at night was maybe not for me. And I was diagnosed with scoliosis when I was 15.
I didn't know that.
I went to my pediatrician diagnosed me with the scoliosis and sent me to an orthopedic surgeon. So I went to an orthopedic surgeon who did x-rays and said, "You're not that bad. Look at this other person who's doing surgery tomorrow." That scared me.
Yeah.
And so my mom took me to a chiropractor that we knew. Didn't realize that there were different flavors of chiropractors at the time. So he was more accident injury focused. And he said, "You're 15. Are you in pain?" And I said, "Nope." So I said, "Okay, bye." And that was my first experience. It wasn't until I was looking into careers, I was about 20 years old, and my sister's best friend's mother was going into chiropractic school as a second career. And she said, "Well, if you had gone to the chiropractor during those formative teenage years, you would be taller." And from someone who's 5'1", I would have loved to have been taller.
Every age counts.
Exactly. And so then I was like, "Tell me more. Let me learn more about this chiropractic thing." So after going to chiropractic school, I was in the computer lab, because there was a computer lab back then. And I heard some people talking about driving to Dallas for a pediatric seminar. And I thought, why do chiropractors see kids? Like, they're not in pain. And they said for scoliosis. And I thought, oh
my gosh.
This is what I meant to do. This is it was just a light bulb moment for me. So I went to Dallas every month and took the pediatric certification. It was far and beyond what we learn in chiropractic school. And then I was ready to conquer the world and at that tender age see babies. And people said, "Have you had children?" "No, I just graduated from school."
Yeah.
And they're like, "Yeah, no, you can't work on my kid. But I'm pregnant and I'm having lots of pain and you can work on me." So I built up some rapport and trust with different doulas and midwives in town and pregnant women. And then they felt confident that I could treat their child. Pediatric chiropractic is so much different than what you see on TikTok or what you see on videos. And it's not like cracking a baby's neck. I just had a patient just a few minutes ago that said, "My husband said, please don't do that to our baby's neck." And I'm like, that's not what we do at all. So it was educating parents, and the touch is so gentle because until they're 2 years old, their spine is not ossified, meaning the calcium hasn't come in. It's like shark's cartilage. It's very mobile, but it can be moved and shifted out of position if they were in utero incorrectly, or if it was a difficult labor. They may have genetic things that they got. And they're like, "Oh yeah, our whole family has a hip hike on the left." Like, well, maybe that can
The whole family needs to come.
while the baby's young. So I started working on children that way and helping them with scoliosis, sports injuries, then even younger children with reflux and colic, and finding ways to just relax their nervous system so that things can come online. We're not fixing or curing these things. We're just trying to help them develop to their fullest potential. And then several years ago, we started hearing more about tongue tie and oral tethers and restrictions, and that chiropractors could help. And this was definitely not taught in any of the chiropractic school curriculum or even some of the pediatric certifications I told you. And so we really had to look into pursuing it on our own, and who was the leaders of this, who was leading the charge, and how could we help in that space.
Yeah, that's so cool. And now you have it's not just yourself. You have a full team.
Oh, yeah.
So tell us a little bit about your team at the office.
Well, yeah, we started thinking, okay, we can have a broad range and help a lot of people. We had one chiropractor who was versed in sports, one who was good at acupuncture, and then myself who I was, going to take the label of pregnancy and pediatric-focused. But that was 21 years ago, and now we have 5 female chiropractors who are all pregnancy and pediatric.
Amazing.
And so we all have craniosacral training and have all worked with babies of all ages. I think our youngest was 17 hours old, and that little girl was born at home, and her midwife was like, take her to Dr. Long tonight. She's not opening her mouth right. And whether you're bottle fed or breastfed, if you can't open your mouth correctly, that's not going to work out so well. So I did the lightest touch, and I even was wondering if that helped. I'm like, I'm not sure. I'm going through my training. And she opened her mouth and latched.
Wow.
So it was wonderful to see.
Yeah. You mentioned craniosacral. Can you explain what that is?
Yeah. So the cranium, people think is just a static skull. Once it gets to its full size, that's it. But there's gaps in the cranium. These are the primitive fontanelles in babies where you think of the soft spot. But if you look at an adult skull, there's all these little cracks and fissures because there's movement that happens at these plates. If you have a headache or a migraine, it could be that intracranial pressure that is building up and creating a lot of pressure. The blood vessels are not pulsing normally, whether too big or too small, too restricted. So that when that pressure builds up, we can use light touch and cranial work to help dissipate the pressure and move that. It's not moving the bones necessarily, it's just helping balance the pressure. And so then you don't feel that pressure around your eye, you don't feel that pressure in your sinuses. When it comes to the palate, that is part of the whole skull. The sphenoid bone back there connects to 14 different bones in the skull. And so when a baby is born and it's a little bit off because the sphenoid isn't fused, and we see that one eye is drooping or the face is tilted, that's an indicator that, wow, we might need to do some cranial work on that child before the bone fuses at 1 year of age.
I could just listen to you talk for hours. So informative.
No.
It's amazing.
No.
It's incredible. So you mentioned that, tongue tie has become kind of part of the conversation in chiropractics.
Yes.
And we work together a lot on specifically infants, but also children and adults going through tongue tie procedures and releases. So where do you see, in your prep work, what are you really trying to achieve to allow these patients to be sort of ready for this type of procedure?
Yeah, we're trying to change the patterns, right? And that's what you're doing with the revisions. We're trying to say, hey, your tongue has not been moving in the way that it's supposed to. And as a result, because the tongue is a muscle, everything around it has compensated and is also not moving. So you might be straining in your neck, the scalenes might be engaging, and then you might be hunched forward because you're straining so much with your tongue and you're not breathing correctly through your nose. So if we can help change their body patterns so that they can take in more air, they can get full expansion, and they can move their jaw and in the way that they're supposed to, that's going to play a huge role. It's just a domino effect. Yeah.
Can you touch on the concept of fascia and what that is and how it plays a role in movement and function and specifically tongue ties also?
Sure. So what I like to tell people is if you ever cook chicken breast, there's that thin layer sometimes around the chicken breast, and that's fascia. And your fascia, we used to just discard it like it's nothing, but it actually is this amazing membrane that connects ligament to ligament. And so it goes throughout the body. We talk about the posterior and anterior fascial lines, which can emerge from the tongue and come all the way around, down the back, all the way down to the legs. So if somebody is tight in their tongue, it can jerk them back and create a lot of pressure and tension. And we might see that in like that child who's tiptoeing or the baby who instead of
like
crawling,
stiff like a board also.
right,
the babies,
right. I have a little girl, she's like scooting on her bum and her butt, and it's like, oh, that's not the right way to crawl. So there could be a lot of tension that's going on in that fascia. And so that's why people do like myofascial release. The foam roller is what a lot of adults use to help roll out their fascia. If you'll give me your arm for a moment, and if I twist your sleeve, that's like fascia, right? So underneath, I can be massaging your arm and I get that muscle loose and you're like, it feels so good. But then you come back because you're like, it still feels twisted. It came back again because no one addressed the fascia. And that needs to be addressed as well as the muscle. So we're learning more and more about how to engage the fascia and make sure it's as fluid as possible with the muscle and with the skeletal system.
So do you see if there's an untreated tie that it's hard to keep those adjustments or the muscle relaxed because of the tension that tie keeps kind of pulling back?
We do. Because of all the compensation that's happened, people keep coming in with the same issues. And we're like, okay, something's not right. We're doing our best with these adjustments, but maybe other things need to be looked into. And that's what happened with my daughter when she was 10. And I was like, why is her neck hurting? I've been adjusting her. She's eating a healthy diet, as minimal refined foods as possible. But she had an unresolved tongue tie that we didn't know was that elusive posterior tongue tie. And so we had it revised at 10.5. But that was the start of my journey, learning all of this.
Yeah, it's interesting because almost everyone I talk to, it's a personal thing that, was like, oh wow, this is really impactful, and then we start going down the rabbit hole of tongue ties and airways and breathing. And, when we talk about airway and breathing, yes, the tongue plays a role, but also if we have an underdeveloped palate, sometimes we have to go in there and do some expansion work, or even just, from a traditional orthodontic standpoint, some kids need expansion to fit their teeth in. How would chiropractic care aid in the work of expansion, and what is the importance of doing chiropractic care during those types of treatments?
Well, you asked a question earlier that I realized I didn't fully answer, and that was how would someone prepare for this? And what I see is we know there's a connection between the jaw and the pelvic diaphragm. And so we want to make sure that in a child or an adult, their hips are moving well. If someone's not having good bowel movements, it could be because their pelvis is tight. And then as we move up into the chest cavity, we want to make sure that their shoulders aren't sloped in, that they're able to fully expand and move their shoulders well. And then that neck should rotate. In an adult, we should rotate to 90 degrees bilaterally. An infant should rotate to 110 degrees bilaterally. And so oftentimes people will be like, oh yeah, my kid turns their head. But when you actually assess, they don't turn their head all the way. And so if they aren't turning their head all the way, they're going to grow up with that tightness, and then they're going to use their shoulder more, and then they may be using one side of their jaw and mouth more. So yeah, it leads
domino effect.
Exactly.
Yeah.
So when you're talking about palate expansion, we know that the maxilla drives mandibular growth. And so we want that maxilla to be open, right, and wide in the palate, so that not only their bones can grow the way that they're supposed to, but that everything rests and sits where it's supposed to too. And that helps hormone production. People, I think, sometimes don't realize that it's not just the bones growing, but that's where the pituitary gland sits, and you want your hormones to be also hitting at the right times.
Yeah, that's a really important point. You're right. I don't think that a lot of people really think about that. And just to touch on, like I said, I was not really familiar with what chiropractic care was until I started all this. But what is really the difference between chiropractic care and PT care, physical therapy care?
Oh, excellent question. As chiropractors, we're looking at the skeleton, the structure, and PTs are looking at the muscles. So I liken it to a house. You need to have walls, but you also need to have beams, whether it's wood beams, steel frame, whatever. It's really important to have both. So if you're building a house with wood beams and steel structures, that's great, but now the air can get in and you need walls to support that and keep that upright. And that's where PTs come in and make sure the walls are there. But if you have walls without a structure, someone can blow your house down. So we want to make sure that both are working in conjunction.
So do you work in conjunction with PTs?
We do. We have several PTs that we work with, and then oftentimes if we're stuck on a case, I'm like, I think their muscles aren't working. I'm going to refer them to physical therapy. And we have that relationship with physical therapists who are like, yeah, something's just not right. They're not achieving the goals that we want, maybe it's an alignment issue, and maybe chiropractic can help. If your muscle's really tight in one area, it's going to pull, and then it can cause what we call subluxation of the bone, where things mildly shift out of place. It's a misalignment.
Yeah.
It's not a dislocation, nothing you need like a collar for or a cast, but it's just out of place enough where the whole structure's not functioning well.
Yeah. And if you, like for infants, for example, what are some indicators that, yes, a chiropractic visit would be beneficial? I mean, I know when we note a tie, we refer for, to make sure that everything is moving well and working well prior to doing a procedure. But from a parent standpoint, if I just gave birth to a baby, I mean, my view is that everyone could use it, and I'm sure there's some benefits, but what are some red flags for parents to look out for?
Absolutely. So if their jaw's not opening, like we mentioned, if the child's not able to turn their head fully to one side or the other, if they're tilting and they seem to have a head tilt even when they're relaxed, then that's an indicator that there could be some strain there. If they are mouth breathing and you just see them when they're sleeping and their little mouths are open, if they're dribbling milk and they're not able to make that nice seal, working with lactation and speech, there's some chiropractic things that we could do too. If they have colic, if they have reflux, if they're taking longer than 20 minutes to nurse or down a bottle, those are signs. We see kids also for chronic ear infections and constipation.
And what about work on like a baby that has plagiocephaly or like a flat spot? Can chiropractic help mitigate some of that?
Absolutely. The infant head grows 37% of its adult size, like a third of its size in the first 4 months.
That's why their heads look so big.
That's why their heads look so big, these bobblehead children. And then the growth slows down to 17% between 4 and 6 months, and then it slows way down. So we really want to try and get these kids as early as possible. Oftentimes we find that the plagiocephaly is because there's torticollis or some kind of strain in the neck. And that's where, again, a conjunction with a physical therapist and a chiropractor can identify what is the reason for this torticollis, how can we fix that, so then the head can round out like it's supposed to. If you're not putting pressure on that spot anymore, then the bone is allowed to flow and move. So that's why we want to see them early and try and get that fixed before they have to wear a helmet. But if they do have to wear a helmet, we can hopefully reduce the amount of time they're in their helmet by, again, going to the source, working on the neck, and doing cranial work to help encourage bone growth in that area.
Interesting. Along those lines, it just made me think of, tongue tie and lip tie, we have pretty clear like indicators for treatment and looking at certain muscle movement. What are your thoughts on the buccal or cheek ties and their role in tension and specifically neck, head, body tension?
Great question. Those buccal ties we sometimes find, right? Sometimes don't. I think that they can be pretty flexible and distensible. So we teach our parents, if a child has that, how to stretch it, how to lift it and stretch it. And then we just wait and observe and see if that's going to improve things or not. Is it now that the child still can't flange their lips after doing the stretches? Is it interfering with them being able to nurse properly? Are they swallowing air because that buccal tie is just so tight? Sometimes it will stretch out, but we often look to the experts like you to say, no, that one is just really restricted and is going to need a release.
Do you see any specific correlation with those ties and tension in the head and neck area, or it's more so like lip mobility related?
I see more lip mobility.
Okay. Yeah. I'm just curious because I know that there's still a lot of variability on those types of ties and their impact. I tend to be pretty conservative about treating them, but I was just curious from a body standpoint, what the impact might be. So, I mean, we talked about the infant indication for chiro, which I would say I'm more familiar with. What about for kids?
So more and more kids are coming in to see us because they're saying, Mom, I just don't feel good. Like something's wrong. We have this little boy and he started coming in to see us when he was 8 or 9. And he said, when I turn my head, I feel like I'm choking.
Interesting.
And so they took him to an ENT, they took him to his pediatrician, and they couldn't identify it. It turns out that he was putting pressure on the vagus nerve, and so he was feeling like he was choking because there was tightness in his neck.
Wow.
And so we did some gentle manipulation, and he was very, very nervous at first.
Yeah.
But now, whenever he gets that choking sensation, he's like, Mom, I need to go to the chiropractor.
That's amazing.
We have a lot of young athletes, especially middle school age. They're really starting to get more serious with their sport, and they're like, Mom, I need to go to the chiropractor. Like, my ankle hurts. And instead of just taking Advil or Tylenol, just like rub it, it'll go away. I think these kids are realizing, hey, but when I go to the chiropractor, I feel so much better.
Yeah.
And I want to optimize how I perform.
Yeah.
So we're seeing a lot more kids.
I'm sure you've seen the progression just in the state of our medicine and how our community is looking at it from when you started to now.
Yes.
Can you talk to a little bit about, I mean, it sounds like even kids are more open or hearing about these types of treatments versus our traditional medicine. Yeah, talk to me about some of the progression you've seen and what do you think is driving that?
Social media.
Yeah.
Absolutely. I think that the knowledge is not being held back. People are looking on their devices and they are seeing these TikTok videos, Instagram, and they're being influenced by it for the good or bad, right? And so that's why we're very cautious about the content
what you
that we
put
put out there, and make sure that it's all scientifically valid and we're not putting just like fear-based stories or anything. But I do think that a lot of parents are looking for alternatives, and so we try and work in conjunction with their pediatrician, definitely never against their pediatrician, because the pediatrician still plays a large role. We just feel like we're part of the puzzle. So how much of the puzzle is the dentist, is the pediatrician, is the chiropractor, is the physical therapist? It might be different percentages at different parts in their life, but we want to work as a collaboration and not it's either or.
Yeah, and it's funny you bring that up because every conversation we've had with practitioners on this show, collaboration has come up. And that's because that is what we do. You know, traditionally, I don't think anyone would have thought of a dentist and a chiropractor working together, but we are treating whole bodies and everything is connected. And so collaboration is key. We cannot fix everything just, you know, working on our own. I do love the sentiment of, you know, incorporating the pediatrician because to your point, they are a huge piece of the puzzle. And I would imagine that that relationship has changed over time too. You know, their openness to, you know, chiropractic care and, you know, even the type of treatment that I do.
Right.
Because the landscape is totally changing, you know.
I also think the consumer is driving it, right?
Yes,
and
absolutely.
A lot of times the parents will come in and say, have you heard of this?
Yes.
And to have a provider say, I've never heard that in my life, they're like, oh, I need to go research it. I need to Google. I need to find some articles about it. And so when parents start bringing that to our attention, then we're like, that's a heads up. And I think that's how we met you. Yeah. We had parents who were saying, I've had great results with Dr. Gandhi. Dr. Gandhi is scheduled to do my kids' lip tie and tongue tie. And we're like, who is this Dr. Gandhi? Let's meet her. Let's set up a lunch with her so we can find out her philosophy.
Yeah, no, exactly. And that has been a huge driver for our practice is the parents. And your point about social media, I think is spot on because it used to be we would go to someone and ask for a recommendation and it was whatever information that person gave us at their discretion or their knowledge. And now there is no barrier to entry. You have to be discretionary yourself now, but it is truly, everything is out there for you to see. So I think it's incredible, but we have to be careful about what we're putting out there. And I'm sure this happens to you, but some of my work in the office is, you know, giving people good education versus the education that they've acquired on their own from whatever resources. So I always like to know before going into a room, what do these people know and where did they get their information? Because it gives me the opportunity to then, you know, tell them factual things. And one of the things that's still sort of newer information in my practice is the recommendation to do chiropractic care. Because to you and I, this is a pretty normal collaboration that's happening every day. But, you know, what we need to realize is most dental practitioners out there are not collaborating with chiros, and vice versa. You know, there's still many chiropractors in Houston that don't understand the care that you do.
Right.
And the depth of it. It's
Right.
really the depth, and that's where we have to continue to educate. I mean, that's where something like this comes in, because what I tell patients is you can't go to any chiropractor for your infant, because we don't want them cracking and popping and doing all the things that they would do on an adult.
Right.
This extensive pediatric certification that you have, is the reason we send to you, but also your years of experience,
And we feel likewise to you too. You aren't just any pediatric dentist. The airway centric focus is huge. I mean, I cannot emphasize that enough. It's really expanded my scope of practice, my knowledge base, my awareness in how I treat patients. And so I want to collaborate with people who are like yourself, learning from the latest technology, the best techniques, the research that's out there. It's hard in our field in chiropractic. We don't have sponsors to sponsor research. And if we said, let's do a double-blind study where someone's going to get a tongue tie revision, but they're not going to have any kind of chiropractic, or we do a sham chiropractic adjustment, like you're depriving somebody of something that could potentially aid in their healing and give them greater results. So that's been a challenge.
Yeah. But I think the proof is really in people that have gone through the experience and see the difference. And, to me, it totally makes sense, the field of chiropractic. And that's what people say about when we explain airway development and how it's all connected. So many parents will say, yeah, this just makes sense.
Yes.
Because it does. If you just think about it, it makes sense.
Yes.
And so, for people that are in Houston that need pregnancy and pediatric care, your office is located right here in Bel Air.
We are. We're at Westview Wellness because we were in Westview. We just moved one town over in Bel Air, literally just over the railroad tracks. And so we are at Bel Air and South Rice.
Awesome. And if someone is not located in Houston but looking for pediatric pregnancy, what is the specific certification that they would be looking for in their chiropractor?
Yeah, that's tricky. We don't have a one and only governing body or licensure. A lot of classes we learn from the International Chiropractic Pediatric Association, the ICPA. They do a great job of teaching this coursework. And then people who have taken craniosacral training, Dr. Marty Rosen from Peak Potential, Carol Phillips with dynamic body balancing, Monica Berger. These are some of the leaders in our field in chiropractic that offer seminars to really understand how the nervous system and the fascial system and the airway are all related.
Are there some questions that if a parent is looking for a chiropractor for their child or infant that they should ask to make sure that the provider is the right fit?
Absolutely. I would say, what is your level of education? What is your training? How many years have you been working on babies and infants? Do you have a protocol? What is your protocol? What are the red flags? What are the parameters that you want to see before you say a child is ready for a tongue tie revision? What exercises do you send home with parents? And if they just have a one-page fact sheet, or if they're and they hesitate, I would be cautious, because each child is so unique, and we want to make sure that we are treating the children as individuals and not just oh, you are a left plagiocephaly, you are a right buccal tie, this is how we treat you. No, it's more complicated than that.
Okay, awesome. Well, thank you so much for your time today and being on with us. I really enjoyed working with you, and honestly, your entire team is fantastic.
Oh, thanks, Dr.
And I look forward to further collaboration.
I appreciate you so much. Thank you for your support of chiropractic.
Absolutely.